Hi everybody, thanks so much for joining us for today's Healthy 100 web chat. I'm Jennifer Roberts. Today we're taking on a topic that's the #1 killer of women in America. That's heart disease. We've got a great doctor to talk you through some of the symptoms and how to reduce your risk of heart disease. Dr. Rajesh Shah is a cardiologist here at Florida Hospital Orlando. He's going to be here for the next 20 minutes or so to take your questions on this really important topic. We'd love for you to type those in. We're going to try and get them answered for you live here in the next 20 minutes or so. So please feel free to type in your questions. We'd love to hear from you. But let's start things off right here. The doctor's in. Let's get started. Welcome to you, Dr. Shah.
Hi, good morning.
Thanks so much for joining us. And some of the things we want to talk about, we kind of focused on women and heart disease. It's kind of a big topic in the media. We've just got, Heart Month and barely in the rearview mirror. Tell me a little bit about how women are impacted by heart disease.
It is still the #1 killer in the United States. I think that we are inundated with diseases that are also killers in the United States, as well as breast cancer, HIV, but often many times coronary artery disease doesn't get as much attention, even though it is the #1 killer. The disease itself has been very prevalent. We've just been able to detect it with good history taking, new modalities, and therefore people are getting treated much earlier.
I know we were talking a little bit before we got started. You were saying physicians are now paying a little bit more attention as well, not only the general public, but the physicians as well. Talk a little bit about what has been learned over the years and why doctors are now kind of zoning in on this.
Right. Well, women at least represent 50% of the population. In general, when we see patients, they've always been telling us about symptoms, but we've never been able to make that connection with regards to coronary disease and sometimes atypical or non-traditional symptoms that we detect. Men and women will both have typical symptoms, but there's also a group of women that will have very unusual symptoms sometimes, and we'll work through a progression of sort of thought processes, and sometimes we do end up with coronary artery disease as their manifestation of an unusual symptom.
Let's get right to some of those symptoms. So some of the basic symptoms, we all know the one, the chest pain. That's the big warning sign for heart attack, but there's other stuff out there too.
Well, it's not just chest pain. Sometimes people can have the typical symptoms of chest pain, which is left-sided, exertional in nature at times, a pressure-like sensation, but there are also other symptoms people can have, and particularly many times in women, they can have right-sided symptoms, throat discomfort, scapular pain, like pain in their back. On rare circumstances, they can have what they feel as indigestion-like symptoms, but really a manifestation of their coronary disease. And so if we take all of these sort of non-typical symptoms and work through our thought progression, many times with good testing and good history taking, we end up finding that they do actually have significant coronary disease.
Yeah, I know we all feel like we kind of learned a lesson months ago with Rosie O'Donnell and her going through the heart attack and not calling the doctor right away, recognizing some of those unique symptoms. How important is it to be aware of the symptoms, because it's really time is very important.
Well, the physiology is somewhat different between having coronary disease and having heart attacks. Many times people can have very minimal disease, but a plaque that ruptures is their heart attack, And paying attention to those symptoms in that sort of acute setting is also vitally important, because time is muscle. When they have a sudden onset of a symptom, whether typical or atypical, like we've talked about, should be taken very seriously and should be, thought of as an important thing that needs to get further evaluation. There are other symptoms where people have coronary disease where they have a narrowing and it's causing them chest discomfort, but not necessarily a heart attack, But in those patients should also be taken very seriously, because their disease may be more severe than what we may be able to detect just by their history themselves.
You talked a little bit about women and the focus not being as much on cardiac disease. There's a lot of talk about about other diseases and other times of year, and obviously very serious diseases, and not to minimize any of those, but the focus on heart attack in women especially has really started to ramp up in the past few years. Why is that a good thing?
No, it's a great thing, particularly because like I said, women represent a huge, substantial portion of the population. And many people, actually many women, do get regular routine checks. We're just not detecting the disease because, you know, we as physicians have now become more in tune with the different sort of varieties of symptoms that people can have. As a result, we were able to intervene, modify their risk, and hopefully change the curve where they may have been headed towards a curve where they were persistently having problems with their coronary disease or other heart attacks or heart failure, where we change that, where we modify their risk and they can live a very good, healthy, productive life. You know?
Tell me a little bit about some numbers that, you know, there's been a big push about knowing your numbers.
Yeah.
What are some of the things that people need to know? You're talking about those checkups on a regular basis.
Yeah.
What do you need to know about yourself?
Well, I think that most importantly is that there are things that we deal with when we go to the doctor's office: blood pressure, sugar control, weight. And I think all of these factors play that sort of environmental role in the coronary disease realm. There are two different types of factors that play a role in our coronary disease, which is one is our environment, what we take in, how we live our lives, and one is a genetic component. And it's very difficult to change the genetic component, but our environment we can certainly change. And so getting a blood pressure of less than 120/80, that would be ideal. Getting your body weight down to an ideal body weight, where that would be ideal. Making sure that you don't have diabetes and your hemoglobin A1C is down, which is ideal. Exercising regularly, eating a balanced, regular meal. You know, all of these things play a role ultimately in the long term.
You know, some of those things that you were talking about, these are things that come with a regular checkup.
Sure.
I mean, there's something, so it's just as, really, is it just as simple as seeing your family practice physician once a year and making sure these things are kind of in check?
It's not just that, but it's also personal responsibility. I think that we have to empower ourselves and empower our patients to take responsibility for their own lives. What we eat, how we exercise, how much we sleep, if we take our medicines or not, is completely dependent upon ourselves. And I think that as the pool of patients becomes much more bigger now with women, I think that it's vitally important that we play a very active role in terms of you know, getting our risk factors under control.
Well, and you talked about that personal responsibility. Is there a significant portion of our heart health that we have control over?
Sure.
I mean, certainly genetics is going to play some kind of role in that, but what can we control?
You can control what we put in ourselves in terms of what we eat, what time we eat, how much sleep we get. You know, I got up at 5:30 this morning. We're in spin class running. You basically, you know, and I empower all of my patients to tell them that, you know, I usually tell them this one very basic story, whether it's male or female in general. 95% of their care is going to come from them. The 5% is the testing, whether they need a procedure, the cholesterol medicine, whatnot. But that's the 5% that I can control, and they're going to get all of that. But the 95% of their care is going to come from what they do in terms of empowering themselves to take care of themselves.
So it's what they do every day on a day-to-day
Right.
basis. If they
In
choose the
conjunction
exercise,
with good medical care.
Yeah.
Those are the only things that that have really been shown to borne out to prolong people's life, you know, such as blood pressure, cholesterol, diabetes.
Yeah, yeah. Some of the things that people have been talking a lot about lately, and I know it got a lot of press just recently, is the Mediterranean diet.
Yes.
It's always kind of been out there
Sure.
that this was maybe a heart-healthy diet, some good eating advice for heart health,
Yeah.
but now it just got a boost with some recent research
Sure.
that's kind of saying, one of the stories that I was hearing about said, well, is better, Mediterranean diet is better than statins. And more effective than statins, if you will. So you know, there's a lot of talk out there. So kind of give us your thoughts on.
Well, the effect of that diet, they're trying to correlate as the effect of the cholesterol medications. It's still, you know, as each study comes along, you need subsequent studies to sort of validate what our initial findings are. But certainly, again, what we control what we put into our bodies, and I think that, you know, I don't think that there's only one specific diet that works well for just everyone. You know, you have to sort of modify and adjust, but we should take the lessons of that diet, which is basically low volume, nuts, to manage the so the protein aspect of the things, lots of greens, cooking in vegetable oil. Those are the lessons that are learned from this from this sort of study that we should incorporate into a sort of a greater scheme for heart healthy lifestyle.
I want to take a question that we got in from an email. This is kind of loosely related to heart health, but diets like Jenny Craig and Weight Watchers, do they help help the heart or do more harm because of amounts of sodium in food? So obviously good thing that people want to try and find ways to take down the weight, but some of those prescribed diets, what are your thoughts on those?
I'm an advocate of a disciplined lifestyle, and I think that if we put all of our eggs in one particular diet or lifestyle, it generally brings out sometimes some of the worst things of each things, and I think we should take the best of everything. Many of these diets, their focus is really on trying to reduce the calorie and how many times, or sort of modifying the number of times you're eating. But that sometimes comes at a cost for where we get a little bit more sodium, a little bit more fat. And it may or may not work for you. And this is a very common question that is asked. The woman come in, she's 38 years old, she has 4 kids. She's like, I've got this special diet, I want to run it by you. There's a special so-and-so, et cetera, et cetera. And I told her that, work within your confines of what you can work best for you. Take the best of each diet, what they're teaching you, and basically adjust it and modify it to a lifestyle that works for you so it's durable. The durability of it will make you live long, will give you fruits of your labor in the long term.
Do you know if some of those programs, do you find high sodium to be an issue with some of those?
It can be.
High sodium is generally a heart issue across the board, right?
High sodium will result, one of the issues with regards to high sodium is that there's sodium in almost everything that we eat, soups and a lot of the prepared meals and whatnot, because that preserves some of the water content too as well. The sodium content of it, if you're just kind of thinking through the logic and the processes, is that it would lead to high blood pressure, and the high blood pressure will then lead to a risk factor that is associated with coronary disease. And so you can sort of kind of piece together. Now, it's a stretch because it takes time for these things. It's not just an overnight phenomenon. But again, I think it all comes back to self-discipline in terms of what you are putting into your body. You can take a little bit more sodium in, but as long as it's balanced out throughout the week and throughout the days and throughout the year, generally probably not a problem.
You mentioned diabetes as being a concern. Diabetes does have an impact on our hearts as well.
Sure.
Talk a little bit about that. Diabetes seems to be touching everything these days, but
it is rampant. And we actually saw diabetes as a separate disease from coronary disease. But now the teaching and the thought processes is that it's almost like an equal sign, that when you have diabetes, we treat those patients as if they have established coronary disease. So all of the goals that we had discussed about blood pressure, cholesterol, weight, are really targeted as the prevention of the coronary disease because of the diabetes. Diabetes gets a lot of press because if in New York City, Mayor Bloomberg is talking about reducing the size of the soft drinks.
sodas, yep.
We talk about airlines charging more for people who are obese because of airline. There is a massive societal problem right now that we have because of diabetes, and if we do not control that, the heart disease that we've talked about just in women, but the incidence will rise even more as well as in men. It will be a huge problem, and therefore, when you are deemed a diabetic, lifestyle changes, getting your cholesterol, aspirin, all of these things are targeted towards the prevention or retard. Just bring down the aggressive nature of the coronary disease itself.
Yeah. Any other diseases that kind of link directly to the heart, things that people should be aware of?
Sure. I mean, two that come very much close to the eyes, and it's a matter of location: strokes and peripheral vascular disease. Those are the two areas that are essentially, it's just different pipes in different locations. When you have a stroke, it's essentially a heart attack of the head. And if you have a acute blockage in your leg, well, that's basically a heart attack of the leg, and in very simple terms. But the reality is that the spectrum of disease is very different for each sort of territory. But again, the same goals are always there. Walk more, weight loss, diet control, blood pressure control. All of those same things that we talk about that we talk about with coronary disease, the same thing we talk about with cerebral vascular, peripheral vascular disease.
Yeah, it seems like the vascular disease is getting is starting to get some more press, especially when you come with the leg and clots in the leg and things like that. It's obviously becoming something people are talking more about. Is that something that you are seeing more of, those types of diseases?
Absolutely. We screen patients for that daily, whether men or women in general. Again, people will have all types of different symptoms, and the management of those symptoms is very different, depending on their symptomatology. Some people need more aggressive, some people need less aggressive. Some people may have no manifestation of coronary disease, but they have extensive peripheral vascular disease. Well, you know what? The treatment is still the same. Aggressive risk factor modification. Those management of risk factor modifications have been clearly linked to mortality benefit or life prolongation. It's not that we do procedures on patients that will translate into the longevity of people's lives. They may feel better because of a tight blockage or whatnot, but the reality is that the management of those risk factors is what has translated into lifelong benefits. And therefore, even in our societies, whether in the vascular world or in the coronary world or the cerebrovascular world, the aggressive nature of the modification of these risk factors has really shown to reduce the risk of future events too as well.
As we kind of wrap up the time that we have here, anything you kind of want to leave people with as a parting to kind of say, if you do this, if you do nothing else, do this?
I would encourage everyone to take interest or control of their own lives. It is in their benefit to take control over what they do for themselves and make time for themselves. We live very busy lives with busy schedules, families, etc. And taking the 45 minutes to an hour each day or several days of the week to find time for exercise. Be careful what you put into your mouth, because ultimately it's going to affect you. Will born of fruits of your labor essentially in the long run.
Fantastic. Thank you so much for your time today. I want to thank Dr. Shah for giving us his expertise on heart disease, and of course, learning more about women and heart disease. You can go to visit heartsmartwomen.com and of course take a cardiac risk assessment there, learn more about some of those important screenings that we were talking about, knowing your numbers. And of course, if you'd like to schedule an appointment with Dr. Shah, you can do that by calling 407-303-DOCS. You can find out more about upcoming web chats by liking Florida Hospital on our Facebook page, also following us on Twitter. I know we might not have gotten to a couple of questions, and we'll try and get Dr. Shah to weigh in on those on Facebook. We'll do that here shortly after today's chat. Thanks so much for watching and participating in our chat today, and we'll hope you'll join us again.